Vanakkam. Who says you cannot learn while having fun? Welcome to the Great TANPAPS Quiz, the infotainment program in the run-up to the annual conference of the Tamil Nadu and Pondicherry Association of Plastic Surgeons to be held from February 9 to 11, 2024.
Question number 1. The modern term for port wine stain is venous malformation, capillary hemangioma, capillary malformation, or venous hemangioma. The correct answer is capillary malformation. Vascular anomalies were first classified as the biological classification given by Mulliken and Glowacki in 1982. In 1996, under the ISSVA classification, vascular anomalies were classified as tumors or malformations. The following come under the classification of vascular tumors: hemangiomas, pyogenic granuloma, Kaposi's hemangioendothelioma, and rare tumors like the infantile fibrosarcoma and hemangiopericytomas. Whereas vascular malformations can be slow flow or fast flow malformations, and they can be capillary, lymphatic, venous, arteriovenous, or complex malformations. Question number 2. Classification of the primary tumor in melanoma based on the thickness in millimeters is Breslow staging, Clark staging, Menard staging, AJCC staging. The correct answer is Breslow staging. In 1965, Menard and Hurd reported the earliest correlation of depth with prognosis as far as melanomas were concerned. Clark staging is a qualitative determination of the extent of invasion into the various areas of the dermis or subcutaneous fat. This was given in 1969. According to this classification, Level 1 is in situ melanoma, where the tumor is limited to the dermis-epidermis junction. Level 2, where it is invaded into the papillary dermis but without expansion of the layer. Level 3, where the invasion and expansion of the papillary dermis has occurred but has not gone into the reticular dermis. Level 4, where it has invaded into the reticular dermis but not into the subcutaneous fat. And level 5, where the melanoma has invaded the subcutaneous fat or the associated subreticular tissues. Under the Breslow classification or staging, there is a micrometer reading of the depth of the invasion into the dermis, measured in tenths of millimeters. This was given in 1970. Under this staging, T1 is less than or equal to 1 millimeter invasion, T2 is 1.01 to 2 millimeters invasion, T3 is 2.01 to 4 millimeters invasion, and T4 is more than 4 millimeters involvement by the melanoma. The 7th edition of the American Joint Committee on Cancer AJCC staging system relies upon data related to the primary tumor T, regional lymph nodes N, and metastasis M, similar to the TNM classification. Question number 3. When the mesial buccal cusp of the upper first molar articulates between the mandibular first molar and second premolar, it is called angle class 1, angle class 2, angle class 3, angle class 4. The correct answer is angle class 2. Angles classification is used to describe the anterior-posterior relationship of the maxillary and mandibular dental arches. In a class 1 relationship, the mesial buccal cusp of the upper first molar articulates in the buccal groove of the mandibular molar. In class 2 relationship, the mesial buccal cusp of the upper first molar articulates between the mandibular first molar and second premolar. So here the upper jaw has moved more anteriorly. In a class 3 relationship, the mandible is said to be prognathic, that is, it is more anterior when compared with the maxilla. Question number 4. The following is a feature of the prominent ear: constricted lobule, prominent antihelical fold, concoscapal angle lesser than 90 degrees, concal excess. The correct answer is concal excess, which is seen in prominent ear. When compared to the normal external ear, the features in prominent ear are different. For instance, there is a loss of the antihelical fold, the concoscapal angle is greater than 90 degrees, and there is a concal excess. The ear lobule is usually normal. Question number 5. The following muscle is not a levator of the upper lip: zygomaticus major, risorius, levator labiae superioris, levator anguli oris. The answer is risorius, which is not a levator of the upper lip. There are four main levators or elevators of the upper lip. They are the zygomaticus major, which arises from the zygomatic bone near the zygomatico-temporal suture and inserts into the modulus just lateral to the angle of the mouth. The levator labiae superioris, which originates from the inferior orbital margin of the maxilla and inserts into the muscular substance of the upper lip. The levator anguli oris, which arises from the canine fossa of the maxilla just inferior to the infraorbital foramen and inserts into the modulus just lateral to the angle of the mouth. And the zygomaticus minor, which arises from the zygomatic bone near the zygomatico-maxillary suture and inserts into the muscular substance of the upper lip.
Question number 6. Deep peroneal nerve entrapment can occur beneath the tendon of extensor hallucis brevis, extensor hallucis longus, extensor digitorum longus of second toe, extensor digitorum brevis of second toe. The correct answer is deep peroneal nerve entrapment can occur beneath the tendon of extensor hallucis brevis. Common peroneal nerve entrapment can occur at the fibular neck. Superficial peroneal nerve entrapment can occur as it exits the fascia in the distal leg. The deep peroneal nerve entrapment can occur beneath the tendon of the extensor hallucis brevis. Question number 7. The fracture of humerus capable of causing injury to the radial nerve is the Essex-Lopresti fracture, the Holstein-Lewis fracture, Hill-Sachs fracture, Bancart fracture. The correct answer is the Holstein-Lewis fracture. The Holstein-Lewis fracture is a simple spiral fracture of the distal third of the shaft of the humerus, with the distal segment being displaced and proximal end deviated towards the radial side. So there is an increased risk of acute radial nerve palsy. The Essex-Lopresti fracture is a fracture of the radial head with concomitant dislocation of the distal radioulnar joint and disruption of the interosseous membrane. The Hill-Sachs lesion or Hill-Sachs fracture is a cortical depression in the posterolateral head of the humerus due to forceful impaction of the humeral head against the antero-inferior glenoid rim when
when the shoulder is dislocated anteriorly. The Bankart lesion is an injury of the anterior inferior glenoid labrum of the shoulder due to anterior shoulder dislocation. When this happens, a pocket at the front of the glenoid forms that allows the humeral head to dislocate into it. Question number 8. The number of structures contained in the carpal tunnel are 7, 8, 9, 10. The correct answer is 10 structures in the carpal tunnel. There are 9 tendons contained in the carpal tunnel. 1 to 4, the flexor digitorum superficialis of the index, middle, ring and little fingers. 5 to 8, flexor digitorum profundus of the index, middle, ring and little fingers. 9th being the tendon of flexor pollicis longus, and the 10th structure is the median nerve. Question number 9. The artery marked by the arrow is circumflex scapular artery, thoracodorsal artery, long thoracic artery, subscapular artery. The correct answer is thoracodorsal artery. The third part of the axillary artery gives off the subscapular artery. This in turn gives off the circumflex scapular artery and the thoracodorsal artery. The thoracodorsal artery divides to supply latissimus dorsi muscle and the serratus anterior muscles. Question number 10. The following is a feature of the Hall Finl technique of vertical scar reduction mammoplasty. Inferior pedicle technique, skin marking is elliptical pattern, pedicle is full thickness, pedicle is sutured to chest wall. The correct answer is pedicle is full thickness. There are 4 commonly done procedures of vertical scar reduction mammoplasty: the Lassus, the Leisure, the Hall Finl and the Lister procedures. Let us compare these 4 procedures. The skin marking for the Lassus procedure is an elliptical pattern, whereas for the Leisure and the Hall Finl techniques, it's a mosque dome pattern rounded inferiorly. For the Lister technique, it is also a mosque dome pattern, but it is pointed inferiorly. The pedicle selection is superior or lateral for the Lassus procedure, superior for the Leisure procedure, medial for the Hall Finl procedure, and superior medial for the Lister procedure. The pedicle thickness is 5 mm for the Lassus procedure, 2 to 3 cm for the Leisure procedure, full thickness for the Hall Finl procedure, and 2.5 cm thickness for the Lister procedure. The pedicle is sutured to the chest wall only in the Leisure procedure and not sutured to the chest wall in the Lassus, Hall Finl and Lister procedures.
I hope you liked the video. I enjoyed making it. Please register for the TANPAPS 2024 conference, a wonderful scientific and academic feast where many innovative and interesting sessions are being planned. Do visit the website to see the details and to register. Vanakkam.